Welcome, everyone, to the Vitality Equation. We're here to explore research in health and well-being, one paper at a time.
Excited to dive in today. Got a fascinating one lined up, it sounds like?
Definitely. I think this one has some real potential to influence how we approach health, both personally and professionally.
Absolutely. So the paper we're tackling today is titled Astrocyte Reprogramming Drives Tumor Progression and Chemotherapy Resistance in Agent-Based Models of Breast Cancer Brain Metastases. It's a mouthful, but the core concepts are super interesting.
Okay, break that down for me. Astrocyte reprogramming, what does that even mean?
Right? So astrocytes are a type of brain cell, right? They're like the support system for your neurons. They do a lot of things, from providing nutrients to cleaning up waste.
Exactly. And reprogramming in this context basically means that these astrocytes are changing their behavior. They're not functioning normally anymore, and this change is, unfortunately, helping cancer cells to thrive, specifically in the brain.
So, these astrocytes, which are supposed to be helping the brain, are somehow being convinced to help the cancer instead. That's insidious.
That's exactly it. And what this paper suggests is that this reprogramming is a key driver of why breast cancer, when it metastasizes to the brain, becomes so difficult to treat. It's creating a microenvironment that shields the cancer cells from chemotherapy.
The agent-based modeling aspect is also key here. Instead of just looking at cells in a dish, they're using computer simulations to model how these cells interact with each other and the surrounding environment. That gives a more realistic picture of what's happening in the brain.
Okay, so they're building a virtual brain in a way, and watching how these reprogrammed astrocytes affect the cancer's growth and response to treatment. Makes sense. So what were the key findings?
Well, the model showed that the reprogrammed astrocytes were actively promoting tumor growth. They were releasing factors that helped the cancer cells proliferate and resist chemotherapy. It was like they were actively building a protective shield.
And that resistance is a huge problem in treating brain metastases. It's why survival rates are often quite low. So understanding this mechanism, how the astrocytes are being reprogrammed, is critical for developing new therapies.
Right, this is fascinating because it shifts the focus a bit. We often think about attacking the cancer cells directly, but this paper highlights the importance of the tumor microenvironment. We need to figure out how to manipulate that environment to make it less hospitable to cancer.
Exactly. It's not just about killing the cancer cells, it's about changing the landscape they're living in. And that's where I think lifestyle factors could potentially come into play.
That's what I was thinking. This discovery highlights the crucial role of the brain's environment in cancer development. It makes me think even more deeply about the interconnectedness of body and mind and the importance of lifestyle choices for overall health, especially in the case of brain metastases. If lifestyle changes can alter the environment in the brain to affect astrocytes, maybe there are specific dietary habits, movement practices, or mindful rituals that could nudge the astrocytes away from supporting tumor growth. It opens up exciting avenues of potentially preventative therapies.
Interesting. So you're thinking, could we potentially influence these astrocytes through things like meditation or mindfulness? Could we reprogram them back to their healthy state through cognitive techniques?
Precisely. I'm curious if there's research into how specific types of meditation, like loving kindness or focused attention, could affect astrocyte activity. Could a tailored meditation program be developed as a complementary therapy for breast cancer patients? The concept of astrocyte reprogramming and cancer progression is fascinating. It makes me wonder if there are specific types of meditation or mindfulness practices that could potentially influence the behavior of these cells in a healthy direction.
And I'm thinking about exercise and sleep. We know that both of those things have a huge impact on the brain and on inflammation. Could we design exercise and sleep interventions that specifically target astrocyte activity?
That's a great point. And it raises the question, how do we even measure the effect of these interventions on astrocytes? I mean, we can measure stress levels through cortisol or cognitive function through tests, but how do we directly assess astrocyte behavior in a living person?
Imaging techniques, maybe, fMRI or PET scans? I know they're used to study brain activity, but could they be adapted to look at astrocyte function specifically?
Potentially. Or even looking at biomarkers in the blood. Are there specific molecules that are released by reprogrammed astrocytes that we could track? That could give us a non-invasive way to monitor their activity.
Okay, so let's say we can measure it. Then the next step would be to design these interventions. And this is where I think we need to be really specific. It's not just about saying exercise more or meditate more. We need to figure out what kind of exercise, what kind of meditation, and what dose is most effective.
Exactly. For exercise, maybe it's high-intensity interval training IITI versus endurance training. Or maybe it's resistance training that's most beneficial. We need to drill down and see what elicits the best response in terms of astrocyte function.
And for meditation, is it mindfulness meditation, focused attention, or loving kindness? And how long should people meditate for? How often? It's all about finding the right formula.
And what about combining these interventions? Could a combination of exercise, meditation, and perhaps even cognitive behavioral therapy CBT be even more effective than any single intervention alone? Could CBT or mindfulness-based stress reduction techniques be used to influence the astrocytes and, by extension, the brain's microenvironment in a way that improves chemotherapy efficacy? If so, how would one measure the impact on the tumor microenvironment in a manner analogous to measuring changes in cognitive function with CBT?
That's an interesting point. CBT could help patients manage stress and anxiety, which could in turn have a positive impact on their brain environment. It's all interconnected, isn't it?
Absolutely. And that connection between mind and body is something we often overlook in traditional medicine. This research really underscores the importance of taking a more holistic approach to health.
Yeah, I'm thinking about how CBT works. It's about identifying and changing negative thought patterns. Could it be that these negative thought patterns are somehow contributing to the astrocyte reprogramming? Is there a link between our mental state and the cellular environment in our brain? The idea that astrocyte reprogramming is impacting tumor behavior in a way analogous to how our own cognitive processes influence health conditions is really fascinating and prompts me to think more deeply about the connection between mind and body.
That's a really provocative idea, and it ties into the concept of the mind-body connection, which is something that's been talked about for centuries, but is only now starting to be understood scientifically.
Exactly. We're starting to see that our thoughts and emotions can have a direct impact on our physiology, even at the cellular level. It's mind-blowing, really.
So, how might cognitive behavioral therapy CBT techniques be specifically adapted to target the mechanisms driving astrocyte reprogramming and associated resistance to chemotherapy? What kinds of thought patterns or emotional responses might be contributing to the reprogramming? And how can those be altered? If astrocyte reprogramming can alter the cognitive function of cancer cells, perhaps similar cognitive restructuring techniques could be applied to treat the tumor's resistance to chemotherapy. This opens a whole new avenue for considering how mental processes might affect biological responses and how therapies can be designed to take advantage of that.
Maybe it's about teaching patients techniques to manage stress and cultivate positive emotions. Things like gratitude practices, mindfulness exercises, or even just spending time in nature. All of those things can have a profound impact on our mental and emotional well-being.
Definitely. And it's not just about feeling good. It's about changing the underlying biology. It's about creating a brain environment that is less hospitable to cancer and more conducive to healing.
But this all raises some pretty serious ethical questions, doesn't it? If we can influence astrocyte activity through lifestyle interventions, does that mean we have a responsibility to do so? And if so, how far does that responsibility extend?
That's a really important point. We need to be careful not to put undue pressure on patients. Cancer is a terrible disease, and it's not fair to make people feel like they're somehow responsible for their illness or for their response to treatment.
Absolutely. It's about empowering patients, not blaming them. It's about giving them the tools and knowledge they need to make informed choices about their health without making them feel like they're failing if they don't achieve a certain outcome.
And we need to be realistic about what these interventions can achieve. Lifestyle changes are not a magic bullet. They're not going to cure cancer on their own, but they can potentially play a valuable role in supporting conventional treatments and improving quality of life.
Exactly. It's about integrating these approaches into a comprehensive treatment plan, working in collaboration with oncologists and other healthcare professionals.
So, where do we go from here? What are the next steps in terms of research and clinical application?
Well, first, we need more studies to confirm these findings in humans. The agent-based modeling is a great start, but we need to see if the same mechanisms are at play in real patients.
And we need to develop better ways to measure astrocyte activity in vivo. That's going to be crucial for tracking the effects of interventions and personalizing treatment strategies. The implications of astrocyte reprogramming on treatment resistance make me think deeply about the profound impact of lifestyle choices on cellular processes. I am motivated to explore further how optimizing sleep and exercise routines could potentially alter the course of disease, pushing research forward into preventative and complementary treatments.
And we need to start designing clinical trials to test the efficacy of lifestyle interventions in cancer patients. That means developing standardized protocols for exercise, meditation, and CBT, and carefully monitoring their impact on tumor growth, chemotherapy response, and patient outcomes. Maybe lifestyle changes like mindful eating and regular meditation could be key to preventing this kind of tumor progression. If astrocytes are being reprogrammed, could stress reduction or improving sleep quality somehow play a role in the process?
And we need to be mindful of the potential for individual variability. Not everyone is going to respond to these interventions in the same way. We need to identify biomarkers that can predict who is most likely to benefit and tailor our approaches accordingly.
That's a great point. It's all about personalized medicine, isn't it? Finding the right treatment or the right combination of treatments for each individual patient.
Exactly. And I think this research on astrocyte reprogramming is a really important step in that direction. It's helping us to understand the complex interplay between cancer cells, the brain environment, and our own lifestyle choices.
This also reminds me of something I recently learned about IGF-1. It's fascinating how this hormone, insulin like growth factor 1, plays a role in early development and might even influence how we respond to stressors later in life. There was a study on wild mammals showing a link between plasma IGF-1 levels and early life history traits. What do you guys think about the connection between IGF-1 levels and interventions like exercise or CBT? Could these interventions potentially influence IGF-1 levels and, in turn, improve health outcomes?
That's incredibly relevant. IGF-1 is definitely influenced by exercise. Resistance training, in particular, has been shown to boost IGF-1 levels. And given IGF-1's role in muscle growth and repair, that makes sense. It would be interesting to explore whether specific exercise protocols could be optimized to enhance IGF-1 production in cancer patients and potentially improve their response to chemotherapy or even impact astrocyte behavior.
This is so exciting because it opens up the possibility of developing new strategies for promoting optimal health and development through carefully designed exercise and sleep interventions based on an understanding of these underlying physiological mechanisms. It also makes me wonder if IGF-1 levels affect early life traits. Maybe meditation and mindfulness can be used as tools to improve them. I wonder if regular meditation and mindful movement practices can improve these hormonal markers.
It's also worth considering the role of sleep in all of this. Sleep is critical for hormone regulation, including IGF-1. Could optimizing sleep quality also play a role in boosting IGF-1 levels for improved health outcomes, similar to how sleep is known to affect hormone regulation? This also has important implications to the conversation and paper on astrocyte reprogramming.
Wow, so subtle hormonal factors shape crucial early life characteristics. This reminds me of the power of holistic well-being. If early life traits are influenced by these hormones, it makes sense to approach overall health improvements not just through specific routines like diet and exercise, but also via a holistic lifestyle incorporating mindfulness, stress management, and deep rest, perhaps even incorporating nature into my daily routines.
Yes, and if IGF-1 levels can predict early life history traits, could cognitive behavioral therapy CBT techniques be used to influence IGF-1 levels in ways that improve health outcomes, potentially by changing how the individual perceives and reacts to stressors?
I think all this really highlights the importance of taking a long-term perspective on health. What we do early in life can have a profound impact on our health later on. And that means we need to start thinking about preventative strategies from a young age, focusing on things like nutrition, exercise, sleep, and mental well-being.
I agree completely. And it's not just about preventing disease. It's about preventing disease. It's about optimizing health and well-being across the lifespan. It's about creating a life that is not just long, but also fulfilling and meaningful.
Definitely. It's about empowering people to take control of their health and live their best lives, and to give people access to the help they need to achieve better health, no matter where they come from.
So if we're thinking about future research directions, I'd love to see more studies investigating the link between exercise, sleep, IGF-1, and astrocyte function in cancer patients. I think that's a really promising area with the potential to make a real difference in people's lives.
And I'd like to see more research on the impact of meditation and mindfulness on the brain environment, particularly in the context of cancer. Can we develop tailored meditation programs that can help to reprogram astrocytes and improve treatment outcomes?
And I'm interested in exploring the potential of CBT to influence IGF-1 levels and improve overall health outcomes. Can we use cognitive techniques to modify our physiological responses to stress and create a more resilient mind and body?
All right, I think that wraps up our discussion for today. This has been a really fascinating conversation, and I'm excited to see where this research leads us in the future.
Me too. It's a reminder that health is not just about treating disease, it's about creating an environment that supports well being at every level, a holistic approach in all facets of our lives.
Thanks for joining us on the Vitality Equation. We'll be back next time with another deep dive into the fascinating world of health and well-being research. Until then, stay curious and keep exploring.